What is the most optimal diet for diabetes? Is it keto? Is it carnivore? Is it vegan? I'm Dr. Rawat, an Indian origin, England trained, Canada based physician who additionally studied nutrition at Harvard and founded healthgroupcoaching.com, where for several years I've been running a metabolic disease reversal program. And in this video, I'll tell you the most optimal diet to reverse diabetes. Watch the video till the end because I'll also tell you some foods that you should consume preferentially as they have been shown to reverse insulin resistance. But first, I need to make a confession. This is a video I have been putting off for years now. If you see on my social media channel, I've made hundreds of videos and I haven't made a single specific diet video for insulin resistance. And even when my clients ask me this question, I often dodge the question. And the reason for this is because I understand that simple diet swaps can have some effect on insulin resistance. And certainly Instagram celebrity influencers would want you to believe that. But the reality, and this is what I see on my program and in clinical practice, is that what really has the biggest impact is what happens to your body, to your physique. If you lose 10% of your body fat, if you shrink your waist by several inches, increasing your muscle mass, if you achieve a body recomposition, that is what has the greatest impact. The ideal diet is one which helps you achieve that. And honestly, that might be different for different people. On my coaching program, I get clients from South Asia, Philippines, South America, Europe, North America, and they have different diets. And I've seen success stories, and you're welcome to see the testimonials on my website. The point being that it's a certain diet pattern which will give you results, not a specific diet. But in this video, I will still try to flesh out as much as possible an ideal diet to reverse insulin resistance and metabolic disease, including type 2 diabetes. It is important to understand that the contents of this video might not be applicable to certain types of clients. And these are also clients whom I do not recommend join my coaching program. These are those people who have type 1 diabetes, which although shares the name diabetes, is very different from type 2 diabetes. Also clients above the age of 60 years old, those clients who have a normal or athletic body fat percentage, those clients who've been diabetic for over 5 years, and or those clients who are now taking more advanced medication such as insulin and sulfonylureas. This information might not be so relevant for you. The clientele for whom this information is most relevant would be people with early metabolic disease, fatty liver, metabolic syndrome, polycystic ovaries, obstructive sleep apnea, prehypertension, increased waist circumference, high triglycerides, low HDL, those people who have an early diagnosis of metabolic syndrome, including type 2 diabetes, and have an increased body fat percentage. Those are the people who will benefit the most from this advice. But what is athletic body fat percentage? On my program, I ask my clients to purchase a body fat percentage biometric scale, and I have one which I recommend by the company Renfo. You can check out the blog on my website, healthgroupcoaching.com, under the heading Tracking on the Program. An athletic body fat percentage would be 14% in men and 21% in women. If you're already at an athletic body fat percentage, then most of the contents of this video will not be relevant for you. Equally, if you're not at 14% for men or 21% for women, then there is potential for you to make gains against metabolic disease. Of course, metabolic dysfunction happens in the context of a genetic tendency. And I have explained this in more detail in previous videos. There are genetic, epigenetic, as well as environmental factors as to why someone develops metabolic disease. There will be clients with 40% body fat percentage who can reverse their condition by getting down to 35%. Equally, there will be clients who have metabolic disease despite a 15% body fat percentage. It really comes down to how strong the genetic tide is. What I explain to my clients is you're swimming against a tide of your own genetics. The battle isn't the same for all people, but certainly the higher your body fat percentage, the more likely it is that you'll be able to get gains on improving sugar, reversing fatty liver, reversing polycystic ovaries, etc., easier because there is more potential there. Those people with metabolic disease who already have quite a low body fat percentage have a stronger tide of genetics that they have to swim against. And so in those clients, I will explain to them that there is absolutely no shame in using medication. Try your best with lifestyle, diet. But of course, if parameters like your LDL cholesterol, sugar average, blood pressure, etc. are out of target, we'll use medication to achieve target. And there should be absolutely no shame in that. This is not an all or none situation. We're trying to optimize your health through lifestyle, but we can always fall back to medication wherever we need that extra push. If you check my blog tracking on the program, you'll see that I recommend a certain app called Chronometer for those on my coaching program, which allows them to track their activity, sleep, exercise, fasting, as well as calorie intake. So what's the ideal macro split that I recommend? I recommend a relatively low carb and higher protein and higher fat diet, but nothing too extreme. The kind of split I'm often aiming for would be 30% of your calories from protein, 30% from fats, and 40% from carbs. If you input your weight, activity levels on Chronometer, then the app will automatically recommend the amount of calories you should be consuming for whatever weight loss targets you have. I usually recommend about a pound or 0.45 kilograms weight loss per week on my program. But if a client is morbidly obese, you could go up to double of that, 2 pounds or 1 kilogram per week of weight loss target. Remember that carbs and protein contain 4 kilocalories per gram of energy, while fats contain 9 kilocalories per gram of energy. And so as an example, if Chronometer suggested to you that you should be consuming 1600 calories a day and 30% of those had to be protein, then 30% of 1600 is 480 calories. Divide that by 4 and you would get to 120 grams of protein. But you don't have to worry too much about the maths because Chronometer app can do that for you. There are other nutrition targets that I ask my clients to aim for, including protein of anywhere from a minimum of 0.8 grams per kilogram per day to a maximum of 1.6 grams per kilogram per day. Of course, the more active you are, the more resistance training you're doing, the more protein you'll require to make gains. And a fiber target of anywhere from 25 to 40 grams per day. Regarding a specific diet, I call my diet plan the P4F diet. So I ask my clients to prioritize certain foods, which I call P4F, within an energy balance. So P stands for protein, F stands for fiber, healthy unsaturated fats, fruits and fresh farm products, and fermented probiotic foods. These foods need to be prioritized within an energy balance. Of course, within these food groups, there are certain foods which should be prioritized over others, and there are certain dietary swaps that you should consider making. Let's go through all of these one by one. Protein. Plant proteins that you can get from lentils, legumes, soy products, chickpeas, black beans, fish, seafood, and white meats like poultry, duck, chicken, turkey, which preferably has been grilled, not deep fried, would be preferable over red meats, which contain mostly saturated unhealthy fats, as well as potentially carcinogenic mammalian proteins like beef, pork, lamb, goat. For healthy fats, getting these primarily from fish, seafood, olives, avocados, nuts and seeds would be preferential over unhealthy saturated fat that you get from butter, ghee, lard, red meats, deep fried foods, as well as other solid at room temperature fats like coconut oil and palm oil. For carbs, you'll be much better off with green leafy vegetables, fruits, lentils and legumes, nuts and seeds over refined carbs like bakery items, biscuits, croissants, donuts, Timbits, white, etc. For more starchy carbs, which I recommend shouldn't be more than 25% of your plate, you should prioritize whole oats, millets, brown rice, whole grain breads over the refined versions like white bread, white rice, white flour, because we're trying to prioritize nutrient density over calorie density. You should prioritize consuming whole fruits over fruit juices, fruit jams, fruit marmalade. For snacks, prioritize nuts and seeds, yogurt and fruit over cookies, croissants, and biscuits. For dairy, prioritize fermented probiotic dairy like kefir, yogurt, lassi, soft cottage cheese over cow's milk, butter, and ghee. For cooking, you shouldn't be using solid fats like butter and ghee. Instead, use an oil spray, and you can really use any oil of your choice. Personally, I use olive oil, avocado oil, and grapeseed oil. But because oils are very calorie dense, 1 spoon contains 125 calories. You want to use a spray and use as less as possible. With cooking, avoid burning food, avoid deep frying, avoid char grilling, because these are all inflammatory for the body. They produce advanced glycation and advanced lipoxidation end products which are inflammatory and promote insulin resistance. Instead, do more steaming, grilling, baking. And finally, one food product that I actively recommend to my diabetic patients and those who have insulin resistance metabolic syndrome: soy milk and soy products, tofu, edamame, tempeh. Soy isoflavonoids within these products have been shown to actively reverse insulin resistance. And so if you suffer from metabolic syndrome, diabetes, then it's really pointless for you to be drinking cow's milk. Cow's milk contains saturated fat, while soya milk contains fiber, which is literally the opposite. Fiber reduces sugar and reduces cholesterol, while the soy isoflavonoids within soy milk and soy products actively reverse insulin resistance. So one diet swap, which is a no-brainer for those people who are diabetic or have insulin resistance, is to swap over cow's milk for soy milk. Consume more soy products, and particularly those who are plant-based and are reliant on foods like paneer for their protein intake. Try to move to tofu and use more tofu for the same, because it contains more protein, less saturated fat, and also contains soy isoflavonoids. Now, some of you may be thinking that I was recommending fermented probiotic foods and paneer is a fermented food. So why am I actively discouraging it? Well, it is a good source of protein. However, unfortunately, any dairy product which has been cooked in high temperature will not have any probiotic properties, because the probiotic bacteria will be killed by high temperature cooking. So while your cottage cheese in a refrigerator contains active bacterial cultures and has probiotic properties, which is good for your gut microbiome and metabolism, the same is not true for that cheese on your pizza, because it has been heated. So while raw paneer would have probiotic properties, once it is cooked, it doesn't. And at that level, introducing more tofu for that plant protein with soy isoflavonoids and less saturated fat would be a healthy and beneficial swap. Although this video we talked about diet, it is important to be realistic about the impact of diet changes. Like I said in the beginning of this video, ultimately when your body changes, when your body undergoes a recomposition, a remodeling, when your body fat percentage reduces and your muscle mass increases, that is ultimately what has the biggest impact on your sugars, your cholesterol, your blood pressure. Hence, energy balance is important, as are the other strategies that I coach on my program, including improving your insulin resistance, improving your insulin sensitivity through early time restricted feeding form of intermittent fasting, increasing your muscle mass through resistance training, improving the diversity of the gut microbiome, optimizing nutrition and reducing chronic systemic inflammation, and supplements can also have a role in all of this. If you'd like to join me on my 4-week coaching program to reverse metabolic disease, then visit me on healthgroupcoaching.com. The program consists of 8 Zoom group coaching classes of 1 hour each over 4 weeks, typically on a Tuesday and Thursday evening Eastern Time, as well as tracking on the program, which consists of tracking your biometrics on an app called Chronometer. And this also includes direct messaging with me on the app for that month. I hope you found the video useful. Do share it with any friends or family who will benefit from this information. Remember to like the video, share it, subscribe to the channel. If you'd like to watch some more videos, then Click on the links to watch those, and I'll see you at the next video.